As you've heard, my name is Pamela Kimeto Ting'ei. I currently serve as the Dean, School of Medicine and Health Sciences of Kabarak University. Other than that, I have a big interest in bioethics, and I also have a lot of interest in health informatics. And I'm glad that as nurses, we are starting to see the benefit of having, digitizing what we do every day, because data is a big thing, and that is where the world is going into. Back to what I'm supposed to present today, building sustainable nursing and midwifery workforce. Now, a quick question, or even a scenario. Most of us plant, even if it is just a flower. When we plant that flower, we want it to grow, and we will do everything possible to make sure that that plant grows and it becomes what we want it to be. If it is a flower, we are hoping that it is going to flower. If it is, crops, we are hoping that it will give us maybe a crop out of it that we can use. And that is the same as in sustainability for our nursing workforce. What are we going to do to ensure that we sustain this profession? We know of people going out, we know of people graduating from nursing school, and when they graduate from nursing school, they do not go and do what a nurse is supposed to do. They go to other various disciplines. Every day, we have nurses leaving Kenya to go to other places to work, and that gives us a gap. We have people that go into the service, and within no time, they leave because of one reason or another. We know that globally, we have a shortage of 5.6 million nurses to serve the population of this world. And this affects us as a third world country or a mid-level country because we are training. We have a lot of training institutions, but these people are leaving. What are we going to do to sustain a good workforce for nurses and the midwives? And now, we know that a sustainable workforce means achieving and living within conditions that are favorable. That means we are engaging those we are working with. We are engaging with those that we are training. And so if we have a sustainable workforce, a few things are going to happen for us. Number one, we will retain those we train. We will retain those we employ. We will improve productivity, and we will be consistent in attendance. Nursing in itself as a profession is a springboard to you becoming anything that you'd want to be. You've seen nurses diversify. But what are we doing to encourage our nurses to get certified, to remain as nurses and not change and become something that they did not train for? Elements of a sustainable workforce include 4 things. We have environment, social, systems, and economic. I'll start with the environment. The type of places where we work, for example, if I go with employment, how is it? Is it conducive for the nurses? Who is leading these nurses and midwifery? How is the relationship between the workforces, the different cadres in workforce? We've heard stories of the older ones eating the young ones. Is this what happens in our training institutions? Is this what happens in our employment sites? Are we holding the hands of those that come for them to be able to flourish and grow and love this profession that they got into and remain in it? Social, how much are we paying nurses? Are they able to meet their day-to-day livelihoods? Are they able to even go out there and spend and live and be proud to say, I am a nurse? When I joined nursing, there used to be a saying when nurses introduced themselves, they didn't confidently stand and say, I am this, and I am a nurse. Somebody always said, I am just a what? That tells us a lot about how we view ourselves. When we go to meetings, how many of us are proud to go up front and show what we are doing? How many of us are confident to showcase the new innovations? Are we innovating? Are we doing research? Are we translating the knowledge that we are getting into actionable plans? What are we doing to make a difference? Does the places we work support this? Then we have the systems. That one I've talked about, and I've also talked about this. I have 5 minutes, and so I'm quickly going to go into the role of the universities or of the training institutions in making or in building a sustainable workforce. The first one is developing programs that support and address the ever-changing needs of the population. Has nursing shifted? Is it adapting to what we have right now? I was very happy to listen to digitization that is happening from the second last presenter. That is a step in the right direction. Is it possible for us to now train our own people to be creative, to be innovative, and come up with programs that work for us? We also have to increase the capacity for instructors that are well trained to train our nurses in such a way that when they go out there, they are confident to do the work that they have been given and to get the satisfaction for them to remain there. We also have to leverage on the use of simulations. We have many nursing schools coming up and midwifery schools coming up, but we do not have enough training sites. Are we budgeting for proper simulations for us to be able to give our students a feel of what they would get when they go into the hospital, and when they go out there, they are satisfied and are able to do this? Are we prioritizing the future training and hiring of nursing with the gaps? COVID opened our eyes a lot. We identified the gaps where we need to train. We have people that are prepared in a master's level. Are we giving them a chance to bring a change in the facilities where they are working? What are the new gaps that we are identifying? We have now Ph.D. prepared nurses. When they go back to facilities, who do they become? The world has adopted the nurse practitioners program, where nurses are working hand in hand, shoulder to shoulder with the physicians. They have practice groups. What are we doing in nursing in Kenya? Are we identifying these gaps? Now, as employers, we need to think about burnout. COVID brought a lot of burnout to the nursing fraternity who are working, people who've not gone on leave for a very long period of time. What are we doing to deal with the burnout? Then we have moral distress. There are instances where we as nurses have had to do things that may not sit very well with us. As an employer, what are you doing to make sure that whatever the nurse is doing aligns with what they believe in? We also have lack of analysis on the impact of shortages. You find a nurse manning a whole unit of 80 patients and there are just 2. What is the outcome of that care? What is it? How does this affect the nurse? How are our policies? Do they promote good practice in nursing? Are we as nurses actively participating in coming up with policy briefs to improve our employment, to improve our status? When there is a call to go to Parliament to change a bill, how many of us are going? When it comes to just, maybe an organization calls out for us to look at things, how many of us are going? We need to think about these things because they in turn are going to affect us. Now, when we work on sustaining our workforce, a number of things are going to happen. We are going to have a more productive and engaged workforce. We are going to build a brand as a nurse. We are not going to say we are just nurses. We are going to be the movers in this country in terms of healthcare provision. We are going to save money because we will not be wasting time, bickering about how dissatisfied we are, how forgotten we are, but we'll be sitting and coming up with innovations to make our brand different. We are going to have talent retention. We are not going to have the mass brain drain that we are seeing. And by the way, the nursing that we train in Kenya is appreciated elsewhere much more than we do. We are going to save environment because we are not going to just print and waste a lot of, all these things that we are given in our workplace. And so let us strive wherever we are, be it in your workplace, be it as an instructor, wherever you are going to do. Let's look at means and ways to try and sustain us, to sustain our brand and to grow it better so that we become better providers of care to our clients, to our patients, and in turn we also become better persons for our own selves. Thank you for listening to me.